Lack of preparation can be deadly. Don't assume you will figure it out when emergency strikes. Most families overlook this simple life-saving tool, and your family is not emergency ready until you have a well-equipped first aid box. Sit tight while I give you step-by-step guideline on how to set up your family first aid box. I am Dr. Jane Debe, your emergency medicine physician. Remember, I bridge the gap between you and the emergency room. And if you have not subscribed to my channel, please subscribe now to get more and more of such videos. To set up your family first aid box, the first thing you want to ask is, am I going to use a box or a bag? Some persons may want to use a box, while some persons might choose to use a bag. The main thing is that you have a container whereby the drugs and the equipment are kept. Now, the second thing you need are materials. When I talk about materials, what do I mean? Yes, you need first the first aid supplies. First aid supplies like plaster, you need your plaster. Gauze, you need a gauze. You need a methylated spirit or an alcohol swab, depending on whichever one you have. You need things like scissors that you can get. You also need other things like, okay, this is also gauze bandage. You need things like gloves, which you also can get from any pharmacy shop. Then you need things like scissors. I have a scissors here for you. You need things like scissors because you might need to cut. And remember, this is a surgical scissors, so it's not the one you're using in your house. Apart from these first aid supplies, other things you also need medications. There are some basic drugs you need to have in your house. One is ORS. Every family, every parent needs to have ORS in their first aid box, because when a child is stooling and vomiting, what you need to do is to start replacing the fluid and the electrolyte the child is losing. The next thing you also need to have is you need to have an analgesic or a pain reliever. Yes, something like paracetamol or ibuprofen, depending on the one. Another thing you need to have is you need to have albuterol or salbutamol inhaler. You don't need to start waiting until a child is gasping and you have an asthmatic in the house and you don't have inhaler in the house. No. You must have your inhaler in the house. Other things too you can have in your house. You can have aspirin tablets in your first aid box. Yes, you can have aspirin tablets. There are other medications you can have. Ointments like antibiotics ointment like steroid ointment, yes, and also ointment for burns. We call it dermazine cream. These things are important because when you have some minor burns that can occur in the house, you are not going to pour raw egg or anything. Just apply those ointments and you are good to go. So other things too you need in your first aid are things like the CPR mask. You need to have a CPR mask. You need to have a blood pressure monitor because you need to be checking your BP. As much as you are increasing in age, you should have your own blood pressure monitor. You should have your own glucometer to be checking your sugar. Don't wait until you're presenting late in the hospital and you are now coming. No, if you have a parent that is diabetic, the best thing to do is buy them their own glucometer and the strips. Yes, another thing too you can have apart from the BP monitor, glucometer, is you must have a thermometer. Yes, you are not going to be checking temperature with your hand. Your hand is very subjective. So you are going to get a thermometer and know the normal temperature reading in the thermometer. So when you now have these materials, the next question is monitoring. Why is monitoring important? Some persons will say I have first aid box, but guess what? Some of the drugs in your first aid box has even expired. So you finish using it and you don't know you don't have that drug again. So monitoring is your way of checking whether the drugs here have exhausted, whether they have expired. Are there ones I need to change? Are there ones that need to be replaced? Another very important fact is right placement. The place you are placing your first aid box is as important as having a first aid box. Why do I say that? The first aid box must be placed in a place where everybody, every member of the family knows. Because you might be the one that is choking or the one that is lying on the floor and the person in your house doesn't know where the first aid box is. So it must be a place that is easily accessible. Yes, it can be on the hallway, but it must be also a place that is out of the reach of children. If it's in a school, you can choose to use the teacher's room to place the first aid box or the principal's office, but it must be a place that is easily accessible, where everyone knows, and a place that is out of the reach of children before your children will go and start playing with the drugs. If you have watched this video to this level, I know you must have found value. Then subscribe to this channel and share it so that every other person and every family will have a first aid box, so that we can become medically aware and medically prepared, so that we will not be losing some of the persons we are losing because of just carelessness or presenting late to the hospital. I hope this is helpful. See you in my next video.